Hey guys, what is up? We have a change of scenery for this week. Today, I'm going to be talking about my birth plan. Obviously, it's going to be a home birth plan, so I thought this change of scenery would be appropriate. First off, I do want to show you my sweatshirt. It says, "Have babies where you make them." So last week I mentioned a birthing podcast that I have been listening to, and it's called Doing It at Home. Well, they make merch, and I saw this merch on their website, so I was like, I gotta have it. First, I guess we will do the 30 weeks bump date. You're gonna see my mic cord, maybe. But 30 weeks, I'm starting to feel large. Here we are. I'll give you a quick update on my pregnancy. So we had a 29-week appointment last week, and I did that gestational diabetes test. I believe I said grapefruit juice last video, which is what I was told, but it actually ended up just being grape juice. So I drank that and did that blood test. They said they'd call me if anything alarming came up, and I haven't been called, so I'm sure I passed it with flying colors, which obviously is no surprise considering I'm vegan, I eat healthy. It's really not something that I would even need to be concerned about. But there's that. He's measuring perfect at his week range. He is head down, so she checked his position and he's head down. So I'm happy about that because at our 20-week ultrasound, he was breech, but at the 20-week ultrasound, it doesn't mean anything because they're tossing and turning and all that stuff. It still doesn't really mean much because he's still small, so he can still flip and move, but it just kind of gave me some peace and comfort that he's positioned right. And usually when they get locked into that position with the first baby, at least this is what my midwife said, is they stay that way. So come on, baby. And then as far as my weight, I've gained 20 pounds so far, so we got 10 more weeks. Let's see how big we get. And then also symptoms, just still that pelvic pain and discomfort in my pelvic area. It's really just like muscle aches, like just aching, but we'll get through it, just a few more months. So anyways, my birth plan. I obviously am planning to have it at home. This actually changed when we first started going through the birth center. We were planning to actually have it at the birth center because they have those big, nice, fancy jacuzzi tubs and all that. But getting closer to time and, finances and all that, and just because we think it'll be more special doing it here, I won't have that big old jacuzzi tub, which is pretty much the only reason we were considering the birth center anyway, so I think I'll live. I have a normal tub that I can get in if I'm feeling like back pain and needing that comfort, because I hear that the warm water really helps. So we are having it at home. It doesn't really matter to me where. I think I'm just gonna go with the flow. I'm gonna walk around. It can be in the living room, it can be in here in the bed, whatever. I don't have necessarily a specific plan. I do have a position. My top pick would be the squat position. I just feel like that would just be easy. And like I said in my last video, it shortens the birth canal. It opens everything up, and it just, yeah. I think that would be a really cool position to give birth in. So that's my top one. But if it doesn't happen that way, that's okay. Whatever I'm feeling in the moment, I'll listen to my body and go that way. The second position that I think I would like would be leaning back, probably up on this and holding my legs back, sitting up, and we'll see how it goes. I am planning to vlog my birth so you guys can see what that's all about. That'll be exciting. I'm excited for that, for me to be able to look back and remember it and just kind of share my journey, since you guys have been here from 25 weeks. Of course, I'm sure you want to see the birth. And so starting in early labor, like when contractions start, but they're still tolerable, I'm still laughing, I'm able to talk. If it's night, I really want to try and get as much rest as possible, sleep through it. Even if it's during the day, take some nap, rest, relax, because I'm well aware that this is going to be a long process. So I want to be able to be prepared for those more intense phases of labor. I would also like to go on walks with Tim, you know, just enjoy that. One thing I do plan on doing is having sex in that early stage of labor because, one, I mean, that's a nice thing to do for Tim, considering after birth you're not supposed to have sex for 6 weeks. Maybe this is too much information and maybe you're like, ew, but the plan is to have sex at some point during that early labor, and mainly because semen contains prostaglandins, which help ripen your cervix. So when you're in those early stages of labor, your cervix is shrinking and being, you know, ripening up to start opening, and semen has those prostaglandins to help do that. Sometimes, like in doctor's office, they try to induce labor by doing a gel that has prostaglandins on it and putting it on your cervix. So this is just a natural induction. So I plan to do that. I also plan to cook my midwife some food or get all that prepared and make sure the house is clean and prepared for after baby. In a book that I listened to, I forgot which one, but it was talking about an old wives' tale or old grandma's tale was go and choose like a long project that takes a lot of your attention to get your mind off of the labor, and then you'll have that baby in no time. I need to talk with them about when they like to be alerted, but my personal plan is to alert them when my contractions are 3 to 5 minutes apart and when they are at least like a minute long, because that's when things start ramping up. That's when you're about to transition and go into the pushing stage and all that. I want to labor at home with just me and Tim for as long as possible. We do have 2 large dogs, so I will be taking them to my sister's house. Hannah, if you're watching this, hopefully I've talked to you before this video comes out, but if not, surprise. Another thing, something to think about for your own personal birth plan is who's going to be there while you're giving birth. Personally, I thought that originally when finding out I was pregnant, I thought, you know, I'd have all these people there, but I have since kind of changed my mind. I think I really want this to be a moment for me and Tim to connect and bond, and this will be a really life-changing and empowering moment, and it'll be really special that it's just us and welcoming like our first kid, expanding our family, and just having that time just us alone. And then of course the midwives, because we need them. So it'll be me and Tim, obviously around the house. I'll have the option to get in the shower. I'll have the option to get in the bath. I won't be able to birth in my bathtub because it's just a standard size bathtub, and you have to be able to, like, you know, spread your legs fully in your bathtub if you do a water birth. So I'm not doing a water birth this time. I could rent, you know, the birth tub, but I don't want to deal with all that. That seems like a headache and a lot of work. We're just going to live without it. The plan is when it is time for the baby to come out, Tim's going to catch the baby. I think that it'll be so special, so exciting, and it'll be really good for him to solidify, like, hey, I did this too. I was a part of this. I just think it's a perfect thing. We talked about it, and honestly, I thought he was going to say no because he gets grossed out about medical stuff, but he was like, yeah, I'd like for him to be bare chested and bring him up to his chest so he can make that imprint on the baby and then lay the baby on my stomach or my chest, depending on how long the umbilical cord is. So after baby's born and once he can reach my chest, I plan to breastfeed, and I would like to get a latch established within the first hour or so, get that flowing and going. And the next plan with the umbilical cord is delayed cord clamping. It just allows all the blood from the placenta to be drained back into the baby. You want them to get all that blood from the placenta. It increases the blood volume over 30%. This increases the amount of iron and hemoglobin in the baby's body, and it can prevent iron deficiency for that first year of life. How you know when it's ready, you can tell because the fresh cord has like a spiral and it's pulsing, and then the one where all the blood is drained out of it is white. This is really good for your baby. So if you haven't thought of it, maybe you should consider that. Another thing that I'm planning to do is no bath for probably a week, really just until that vernix is all gone and soaked into the body. Babies in the 3rd trimester start to develop this vernix, and it's that cheesy white stuff that is on a baby when they're born, the closer to term the baby is, the less they have. But this is really good for their skin, and it protects them from any pathogens because it has an antimicrobial property. It can help your baby regulate its temperature, and it helps stabilize the baby's pH. So it's all good. It also acts as a natural moisturizer. I'm planning on encapsulating my placenta. I'll take it daily as vitamins. This helps prevent postpartum depression, and it helps your iron levels. Iron levels and postpartum depression have a correlation. And then it also helps boost your oxytocin, and that oxytocin boost helps regulate your uterus to go back to normal size. So obviously we'll have no interventions. The only one that I would even consider is if my labor is not progressing. The only one I would consider is potentially breaking my bag of waters, but really don't even want to do that. All those other ones I listed in my other video, which I'll link that video below. I'm not about it. So no interventions, having that natural labor. Something I did forget to mention in my other video was when you don't have interventions during labor, if you don't have an epidural or Pitocin, there is this natural birth high after your baby is born. High levels of oxytocin invade your body, this mothering ability, the production of prolactin, which helps with breastfeeding. I forgot to mention that those interventions can prevent this level from happening because they prevent your natural hormone to rise. So essentially that's it. That's my birth plan. Pretty basic. We're counting down 10 weeks, give or take. You may be wondering, I'm not birthing at home. Should I have a birth plan? Yes. You should have a birth plan, probably more so if you're delivering in a hospital. This would mean that you've done your due diligence, you've done your research, you know what you want, you know what you don't want, or you know what you're flexible on, everything like that. I will tell you, you will not be a popular patient in the hospital with a birth plan because nurses and doctors eye roll at birth plans, but who cares? This is your birth. This is your moment. This is your story. Have a birth plan and have that in place because it's really hard to have a baby in the hospital when you don't have any idea what's going on, because then you just go with whatever someone says when that may not be the best option. So yes, have a birth plan. I hope that was helpful. Hope that gave you some ideas for your own birth and your own birth plan. So thank you guys for joining me. Appreciate it. And I will see you next week.